Hi everybody, this is Alexis again, a level 2 occupational therapy student who I created a week-long series regarding self-care and how it can be affected with kiddos who have sensory processing disorder. So in this video today, I'm going to be talking all about clothing and showing you a certain technique to kind of help with the whole dressing process. So kiddos with sensory processing disorder may have a tactile defensiveness to clothing, which causes them to not wear certain types of clothes um, due to how it feels on their skin and like the different textures. So some things that you might want to take into account are seams and tags. I know when I was little, I never liked to wear socks that had seams, so that was always a struggle. And then tags always bothered me, and to this day, I still cut off the tags in majority of my clothing. And I don't have sensory processing disorder, but with a kid with sensory processing disorder, that could be exacerbated. That could cause a complete disruption in their day, and then you may not be able to get them to do anything else, or it may take hours just to get them dressed. Also, you should try to find soft clothing that's not stiff or scratchy. So a good suggestion would be like just all natural clothing, which I know may be hard, but it may be like hard to find, but it may be the best alternative. And also socks that don't slip down. So finding like a more of a tight fitting sock so you don't have that problem of it slipping down. Avoid bunching. And then another good thing would be to have heavy clothing for additional input. And then like I said in a previous video, sleeping and being comfortable in order to get to sleep are super important. So try to experiment with your kids' pajamas. So in this video, I'm going to show you a technique called brushing. It is a part of a complete protocol that was developed by Patricia Wilbarger, who coined the term sensory diet. So this technique is part of a complete protocol, like I said, DPPT, or Deep Pressure Proprioception Technique. And Patricia Wilbarger, who is she is an occupational therapist and a clinical psychologist. She's an expert in sensory defensiveness. So she understands like the over responsiveness of the protective responses of the nervous system, excuse me. So there are 4 main benefits of this brushing technique. The first one is that there is an improved ability to transition between various ADLs. There's an improvement in ability to pay attention. There's a decreased fear of being touched or having that anxiety of being touched. And then the last one is a long benefit, but it is like an increase in ability of the central nervous system to use information from the peripheral nervous system more effectively, resulting in enhanced movement coordination, functional communication, sensory modulation, and self-regulation. So all good things that you need to have. And those are probably all things that kiddos with sensory processing disorder have trouble with anyways. So like I said, this is just the technique that I'm showing you. The whole protocol you need to be trained in, and like you can go to classes for that as well. So I'm just going to be showing you the brushing technique. So here's the brush. It looks like this. It kind of has like these soft bristles. This is called a TheraPressure brush. So like I said, the bristles are pretty soft. And what you're going to do on the kiddo is every 90 minutes to 2 hours while the kid is awake. So if they are sleeping, you would not wake them up. You're just going to carry out this brushing technique. So what you do is you kind of apply, you're going to hold the brush horizontal like so, and you're just going to apply firm pressure starting with like the arms, going to the back, and then working down to the legs and the feet. So the amount of times that you like apply like a stroke, it doesn't really matter. It is all dependent on the kid. So if the kid can only tolerate like 3 strokes per arm and leg, and that's all they can tolerate, then that's what you do. If you have a kiddo who can tolerate longer, then go for it, because it's going to help them keep calm and grounded, and it's going to provide that additional proprioception input. And like I said, make sure that the brush is held horizontally like so. And you're going to avoid places, well, 4 places actually. So don't brush the face. You're not going to do the chest, the stomach, or the genitals. Because all of that it's probably going to influence the urge of urinating or vomiting. And we don't want that to happen. Also, when you do this brushing technique, you should follow it up with joint compressions, which I will show you in a little bit. So you're going to apply joint compressions to the fingers, the wrist, the elbow, the shoulder. You're going to do it to the hips, and then the knees, and then the feet. So you're going to apply 10 compressions at each spot. So one thing is you can carry out the joint compressions by themselves, so you don't have to do the brushing with the joint compressions, but you can never do the brushing without the joint compressions. So brushing plus joint compressions always, and then joint compressions can be completely by themselves. So those are a couple techniques of this whole big protocol. So I'm just going to show you a few. I don't have an actual person to demonstrate this on, so I actually found a stuffed animal that I'm going to attempt to demonstrate this on. So I'll be right back. Okay, so here's the bear that I'm going to attempt to try to do the brushing and joint compressions on. It's going to be a lot harder to demonstrate on a bear than a normal person, obviously, but I will do the best that I can. So like I said, you're going to hold the brush horizontally, and you're just going to start brushing down, and you don't want to try to lift the brush up. So this one's going to be a lot harder because this bear is extremely tiny, but you're going to start with one arm, and then I'll turn the bear around. You're going to want to do a W on the back, and then you're going to move to the other arm, like so. It's a lot harder when it's not an actual person. And then what I would do is I would go back down the back and try to get to the leg. So you're just going to apply some strokes to the leg. Now, in order to get to the other leg, you are going to have to lift the brush off, and you're going to do the other leg. Like so. So a good thing to remember is that you should try, you can brush over clothing if it's thin. If they do have jeans on, I would roll the jeans up because they're most likely not going to feel like the pressure given. So you can brush with the clothes on. And then we still have to do the joint compressions, but another thing I was going to say about the joint compressions is that if they are a bigger child, they can provide that input to themselves by doing like jumping jacks, or you could do wall push-ups, anything that provides like that proprioception input. So I'm going to move the camera back down and kind of show you the joint compressions. So if this was their hand, I would hold it right here, and I would just kind of push it in and out. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then say this bear had an elbow, I would go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then the shoulders, I would kind of go, you could do both at the same time, but since I can't really hold this bear that well, so you would raise the arm up and just go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And you would also do that to the other arm. And then for the leg, what I would have the child do is lay on their back and bend their knees so that you can get the knees and the hip at the same time. And I would just go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then you could do the knees and the ankle at the same time and go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And you would do that to both legs, and then I would give the feet a good squeeze and count to 10. And then I would give the hands a good squeeze and count to 10 as well. So that's kind of how you do that. It's really hard when you don't have a person to demonstrate this on. But some behaviors that you're going to kind of look for to see if this is working is if they have less frustration, if they can tolerate clothing, if they have more communication and interaction with people. Um, so there are some of those things, like less anxious, less antsy. Those are some of the different behaviors that I would look for to see if this technique is actually working. Um, since it is a lot harder to demonstrate on a bear, hopefully you guys got like the gist of how you would do everything. And like I said, in order to actually carry out the whole protocol, you do need to be trained in this. So these are just a few techniques of that entire protocol. Thank you guys.